Hello friends, today we'll be discussing on how to approach ear ENT. Okay, majorly we'll be talking about what are the how to form a general template and how to fit things into place and how to have a easy narration so that you are not in a position of forgetting things during exams. Okay, make sure you stay till the end because I've discussed about all the clinical features and examination findings at the end at one more cause because I want you to focus majorly on middle ear. Okay, so again for convenience sake again I have divided into external, middle and ear, but this is the most important thing, so we'll be discussing about middle ear first. So before even discussing about middle ear first, I want you to have a anatomical overview of a middle ear, I mean of any for it might be due to ear, nose or throat, then you will have an easy narration. Okay, so again while coming to middle ear, these are the diseases which we have. Again I have classified it as infection, tumors, again something related to nerves and miscellaneous. Okay, so again these are the conditions which you have. Again SOM is that is glue ear is not an infectious, but again since it has fluid I have included under that, but again there are few things which you need to consider while writing the same while writing the answer for that questions also. Then again these are the other parts, other miscellaneous things which you need to concentrate on. And facial nerve, again this as a separate narration, so you need to study this differently. Okay, which we have already discussed in the main video. Again with these things let us go and fit things according to our plans so that we have an easy understanding of things so that we will not forget anything. Okay, the major important thing of ENT is that it's a very good subject and it's very easy to remember. So again, when it's an infectious disease, while writing clinical feature, again cardinal signs of inflammation from pathology, right? But again these two things are something which you need to remember. Under general you have to write about fever. Again if they are asking about CSM, two things which you need to mention is discharge and hearing loss. Without these two things you cannot write a clinical feature of a CSM. Again you can write complication and then mention about pain, then it indicates mastoiditis or pityositis, all those things. But again for that clinical feature again I have extensively discussed in the main video, so I'm not discussing that part here. But what is the main aim is that here to give you a general overview. Okay, so again in otosclerosis, what is the major thing which you have to write is about the gradually progressive hearing loss and paracusis Wilson. Okay, then again in tympanosclerosis, what is the important thing which you need write about is the hearing loss. Okay, again while writing examination thing, again divided into what is the major thing which you do, that is otoscopy and tuning fork. Okay, so based on this, these are the things which you need to mention. Again for an infectious part, that is acute otitis media, this is how tympanic membrane appears. Okay, it's again signs of inflammation. But here again if it's a tubotympanic part, you need to mention about the perforation where it is. Okay, this is most important thing which you have to write. Again tuning for things for sake of convenience, every diseases in middle ears states the same, that is what is that, it's a Ringnes negative and Weber's test is affected to the lateralized ear. Okay, this you can write blindly for everything. Okay, this is one of the important thing why things become easy when you do general templates and fit things according to diseases. Again for investigation, one important thing which you should write is HRCT. When you write HRCT, I mean for ear anywhere, if you are it's an operative thing, then HRCT is the best. And again for nose, again CECT is the best. Okay, these are the main important things. Again you can write again AOM is a clinical diagnosis. What and also by writing investigations, what are the major broad divisions which you need to write is about one, related to audiological investigation is must, either pure tone audiometry. Again if it's a middle ear, you can write about impedance matching. And also if it's an inner ear, you can write about otoacoustic emission also, depending on the question. But PTA you have to write it for almost all, and you have to write about what is the bone what is the bone conduction and what is the air conduction, whether there is a gap, what is the inference. Again all things, what is the important thing which you need to remember, everything in middle ear is conductive hearing loss. So what is that, again it remains the same thing. Again if you should to know, you need to know about the tympanometry, that is impotence, right? So again you will write about that. And if there is complication, obviously go with myelinotomy. Okay, again CSM again goes with the same thing. Okay, so and also one about audiology you have to write again about the blood investigation. Since it's an infectious protocol, you have to write about all the CBC. Then again biochemical and microbiological. Biochemical you write about the CBC, TLC, then platelets, and also microbiological you do an oral toilet with culture and sensitivity. Okay, then again radiological investigation for to know what is the I mean as a pre-operative investigation to delineate anatomy of an individual. Okay, for any investigation you can write, you can mention this. What people do not mention is about the audiological investigation, which is a must. Okay, then again CSOM, if it's an aticoantral type, again you can, the major thing which I told you is HRCT, but again if you are suspecting intracranial or complication, then you have to go with MRI. Okay, then again OM with effusion, which is nothing but glue. These are the things which is there. Okay, then otosclerosis, you have to mention about these things. Whenever there is some sign, you have to put a box. Got it? So this is how it is easy. That's why I'm saying if you are not getting above 60 in ENT, then it's a crime according to me, for a fact, because this is one of the easiest subject which you will have. Okay, so you need to have a general template fit those things, especially since you all know here has the maximum weightage of 43 marks, and also major things which they ask is about the middle year. And also if you have have things like this with general template and putting these things under box and with a good handwriting, then who is stopping you to get above 60? I don't know. Okay, then again if there's any stage and tube dysfunction, these are the things which you need to write. Again you have a general understanding of tympanometry. When will you see type P, when will you see type C, when will you see type A. Again if there's fluid, you will see that. Again if there is any fixation, you will see what kind of curve. If you have that general idea and if you know the pathogenesis of this, there's nothing to study even a day before examining ENT, except for anatomy, physiology and diagram based question, if you ask me. Okay, then about tympanosclerosis, I have to mention about this. Okay, again one important thing about glomus tumor in clinical feature itself is pulsatile in nature. You have to mention about this brown sign on examination. Again this is the same thing. Okay, so that's how easy ENT is, provided you know how to fit things in place and develop a proper general understanding and also have proper things in mind. Then overall idea about treatment I will talk here. Again I will discuss about something at the end. Please stay till then, because there is an increased need of having if everybody are writing the same thing, then what is the true differentiator from you from the rest of the people is what I will be discussing at the end. So make sure you wait till then. Okay, then what are the major treatment options which you have in ENT? Again if it's an infection, obviously you need to have antibiotic. Then you have to basically first you need to drain it, then you have to start with antibiotics. Okay, then if there is pains, you have to give analgesics. Either you can give diclo or aciclo. Again, if there is ET, the stage and tube dysfunction, you have to give decongestant. Again, what are the options in surgical things which you have? If it's an effusion, then you have to provide aeration. Obviously, go with grommet insertion in AM, OM with effusion. Correct. Then where do you go for stapedectomy and stepidotomy? You go in otosclerosis plus hearing aid is something which all will forget, but this is the major thing which they will be looking for you in the paper. Then if it's a dry ear, you obviously go with tympanoplasty. Then if it's a mucus that we call steatoma associated CSM, obviously go with mastodectomy. Correct. This is the overall management which you have. You cannot have something more, something less. Then also you need to talk about the precautionary measures and how do you prevent it. That's it. Prevention is again hygiene. Got it. So again, see, investigation. Again, if to look for complication, you have to do HRCT or MRI. For audiological investigation, again, you will have PT or impedance. Again, how do you proceed it? Infectious protocol. Got it. So middle year, please go through properly, because this is where you will get lot of question. And if you have a proper overview, again, you can develop your own notes and classify things, put a box and do highlighter, all those things. But I am not a great fan of that. I can remember things even in a bad handwriting. So I'm doing this. Whichever is comfortable, you have to go with that. Again, facial nerve palsy is something which I have not done here, because this has a separately different narration. Again, you have to go with topodiagnostic test, all those things. Okay. So that's one important thing which you need to, this is one of the major things. Again, if it's a glomus tumor, how do you manage it? Again, there they will ask you only about clinical feature and investigation. Management itself is not asked as much. But again, what is the major thing? Again, is something which you need to go and see again. Okay, that's what I'm saying. What is the function? Whenever your physiology is proper, you will not go wrong while writing clinical feature, because what is the function of middle ear? To give a hearing, okay, to maintain what, to main, and to have a proper hearing you should have a proper aeration, which will be done by eustachian tube. Again, if there is some infection, what will happen? You will have discharge. And again, if there is an inflammation process going on, you will have pain. These are the only clinical features which you have. You cannot synthesize more, or you cannot, leave things. So with these things, how do you fit things into place is something is left to you. Okay, that's where your expertise comes into action, or expertise comes into play. With my clinical knowledge and with my experience and with my things of what I have studied, this is what I was able to come up with. Okay, now coming to external layer and middle layer, because these are the places where they don't ask much questions, and these are the only questions which they are asked. Either you might have a foreign body, there you will ask how do you manage. First you should know whether it's living or non-living. Again, this has a different direction. Obviously you go back and see how do you answer that question, which is already explained. This too is nothing but again the infectious protocol. You have to mention the same thing, but what is the major important thing which you need to mention is about the pain and discharge. Okay, then again, what are the other masses which you can see? Never they will ask how do you manage wax. Okay, but just to mention I have written. Again, what are the other tumors which you can do? Exostosis or keratosis obturans and preoccupant sinus. Again, this is the congenital thing, and this is the RH2 type of question which I am not even expecting. It might come, okay, but I am just saying. Okay, so if you have this kind of overview in your mind, you know what you are dealing in already. So you need not break your head a day before exam. Even if you are going somewhere a day before exam, I think it's fine if you have this kind of approach. Okay, now coming to clinical feature in external ear. Okay, so basically what, again, till middle ear you will have conductive hearing loss. Again, it might be due to obstruction or due to tumor, or it might be due to wax. Okay, then again, if there is a mass, obviously we will have a swelling. Now what is extra in that? Correct. Then obviously what it has pain sensitive receptors, not like in a ear. Obviously we will have otalgia. If it's a mild, then it's fungal. Again, if it's severe, obviously it might be due to some malignant otitis externa, furunculosis. Okay, then obviously you know Aspergillus niger is what color? Black color. Obviously if it's otomycosis, discharge will be in black. But if it's a profuse, you know it's a bacterial condition. With only these 4 clinical features, fit things into place and come back. Okay, anyway they might not ask much questions from this. Basically they will ask you about clinical feature on examination. Again, investigation management, I have not seen any question being asked. Okay, I hope this is clear. And again, obviously what do you see in the external auditory canal, and if it's a canal narrowing, what are the things which you will suspect? That's it about external. There's nothing much which they are asked. Again, these two things are separate narration. If you want to go in depth and write, obviously you can go and write. Depends on marks, right? So I'm not discussing much. Again, in a year, again you might have an infective condition or a non-infective condition. Again, vestibular neuronitis is something which will come here, but I missed it. Okay, so again, other kind of diseases which are in the middle ear. Again, these are the things. Okay, one important thing which again, functions of inner ear. What are the functions of inner ear? Obviously it will provide hearing and balance. Again, if there is an infection, what is the important thing? Can discharge come? If even middle ear is involved and coming out, then obviously discharge will come, but again it's not an important thing. You have to talk about otological symptom and vertigo related symptoms in a clinical feature. If it's an infection, obviously we'll have fever, and if it's a tumor, obviously we'll have weight loss and anorexia. Correct? And obviously, since nerves are getting involved in a tumor, obviously we'll also mention about any other related nerves which are getting involved in, right? 9th, 10th, 11th, 12th. And mention what will happen if you will have a palsy with that. That's it. Got it? And also in vagal symptoms. Why will you have vagal symptoms? In a vertigo patient, you might have a vagal symptoms. Again, hearing symptoms. What is the type of hearing loss which you have? Sensory neural hearing loss. Again, based on how fast hearing loss or how progressive it is, these are the types of hearing loss which you will have. Okay, then again, vertigo also you might have episodic or continuous. If it's continuous, what is it? It's a labyrinthitis, because it's an infective, because it's a continuous process. Correct? But what will happen in BPPV or Meniere's? Again, in Meniere's, what will happen? It will blast and again it will go into a remodeling phase. In BPPV, again based on the crystals, you will have problems. Correct? Based on when they are getting lost, so we'll have episodic. Got it? I hope I am making things clear. That's the main aim, nothing else. Obviously, Even you will write much more things than this, even I will write much more things than this. But what is the major aim is that you should not feel, panicked, or you should not feel uh, uh, anxious while writing exam. That's it. Even if you don't know anything, if you fit these things properly and come, you'll be in a good position to answer. That's the major aim. Okay. And obviously, since on examination you have to write about external year also, middle year also, and also basically about the inner year. Okay. Obviously, depending on the condition, but major thing which you need to mention about here is about nystagmus, and also about specific condition you have to mention specific disease. For example, in BPVV you will have Dick-Salpert test and diagnostic maneuver also you have to mention. Again, many conditions here is what SNHL. So again, it will have the same template for your hearing loss like how we had it in earlier. Got it? And usually in all conditions, tympanic membrane will be normal. Correct? Again, when coming to investigation, again investigation to diagnose the condition. For example, if it's a Meniere's and all those things, then audiological investigation to assess the audiology, including PTA and autoacoustic condition. Also, there's no role of tympanometry as such. Again, if it's an infective protocol, you will talk about that. Again, if you are planning for a surgery, again you will talk about the radiological investigations. Same thing, same narration. It's about how you present now, because knowledge will become limited at one point of time when coming to theory exam, because questions which they will ask will be limited. Correct. So now the major aim is how do you present it. Okay, so that's what I wanted to say. Now ear is done, the major thing where you get 42 marks. Now coming to nose and throat. Okay, now nose, what was the important thing which I found in nose was you cannot form a general template for all these things, because a lot of things are there. But so I subdivided things like how I told in the last video. I have subdivided things. For example, infective, again you will have rhinitis or sinusitis. Again, chronic means TB, leprosy and linoscleroderma. Allergic, these are the condition. Polyp, etomoidal, anthracoinal polyp. Epistaxis as a separate narration, and it's a 10 marker. I don't want to fit things into general in that part. Again, septal disorders, again tumors, congenital, miscellaneous. Okay, for all these things, then again I club things. For example, if it's a mass, okay, then these are the things which you need to talk about. Okay, obstructive symptoms or olfaction symptoms. Again, what is the function of nose? To smell and to breathe. If it's infective or inflammatory, you'll have discharge. That's it. That's the importance of knowing physiology. Okay. So now again fit these things into place. Again, what kind of discharge? Again, watery, mucopollulant. Based on this, again you will say whether it's infective or allergic. Again, you might have bleeding also. Correct. One more important thing. Okay. Then allergic, constitutional symptoms also you can mention. I hope the things are getting clear and things are fitting into place. So that's what I wanted to show. Okay. Then again, examination finding, one important things which people miss. Again, if it's an infective thing, no, what is the major thing which you have? TNS plus HIT, that is hypertrophic inferior turbinate. Again, you need to mention about all these things. Again, how mucosa looks. This is one of the important things which you need to discuss. Sorry, yeah. If there is septal disorders also, I'll just include that. Again, if there's a perforation, you have to mention about whistling sound and crusting. Otherwise, even if you mention about bilateral swelling with obstruction, it's something which is more than enough. Okay, now coming to allergic. Again, you might have allergic is what? Again, you might have DNS or HIT. Okay, then but what is the major important thing? Here it's red and consistent, but here it's pale and edematous, and also you might have dry clustered lesions. If it's a mass thing, what is the important thing? Important thing is external nose might appear normal, or you might have proptosis in what? JNM 3A stage. But you need not mention it, okay, for forming a general template. But you can always have it. Then again, where you can have a mass, again, it might be due to some mass or it might be due to some mucosa itself. Or what I'm saying is, it's not mucosa, but it can be a polyp. Again, if it's pale and glistening and insensitive to touch, again, the probe test, right, which always you will do. Again, it's a polyp. Otherwise, if it's red and vascular, obviously what? It's a GNA. Again, this is what you see in anterior rhinoscopy. What you will see in posterior rhinoscopy is, again, you will see a mass, nasopharyngeal mass. Again, what is the major investigation which you need to do for nose? CECT, PNS. Correct. 1 second. This is the major thing which you will do. do CECT of PNS. Okay, this is like basic investigation which you will do. Again, the same thing. Again, there is no audiological investigation here. So again, it's an infective. You have to write about this. For to check for obstruction, you will write about this. Okay. And again, what is the major thing? Again, in the mass, it's always a surgery. Okay. But if it's an allergic, obviously, you will write about this. If it's an infective, you will write about antibiotic. Then again, supportive treatment include nasal hygiene, then douching, okay, saline spray, okay, all these things will write. Again, stay till end of the video because that will be the true game changer. Okay. Notes is only that's it, okay. Because functions are less, diseases are less. But again, epistaxis important thing I have not discussed because very important things I am not discussing because I don't want to form a general template and sit, because having general template to all other is fine, but something which will come, you have to have definitive answer for that. Okay. And again, coming to throat, again I have divided into oropharynx, nasopharynx, oropharynx and laryngopharynx. Again, nasopharynx, one important thing is adenoid. Again, here anatomy and physiology based questions are something which they are being asked. Okay, for example, blood supply of nose, all those things. But again, if they're asking about adenoiditis, obviously we'll do an infectious protocol disease which I have discussed with something which will write. Okay, these are the diseases which are there in other condition. Again, the thyroid, again lingual, again congenital condition related to thyroid damage, and DD1 midline neck mass is something which is a surgical topic. I am not. You can go and watch the main video of that. Again, esophagus, you can watch surgery video. But again, there's nothing much. They will ask you causes of dysphagia. Obviously, you will have anatomical cause, physiological cause. Okay. And I'm sure you will go about it and manage this thing. These two things I'm wantedly not discussing in this part because it's a surgical topic, but very important to study a day before exam. Okay, now coming to oropharynx, again I've divided things. Okay, again this is done, nasopharynx is done. Again, nasopharyngeal carcinoma is something which is important, but what is the major important thing? Bilateral glue. If you are seeing that, then in a child it is an adenoiditis, but it's in an old adult it is nasopharyngeal carcinoma unless proven otherwise. Okay, that's one important thing. Again, nasopharynx is done. Again, I am talking about oropharynx. Again, I am divided into these parts: infectious protocol, stones, premalignant lesion, again miscellaneous with the tumors. Again, salivary neoplasm again is a surgical topic where you will talk about pleomorphic adenoma and all this stuff. Again, infectious diseases, again major things is only this, but this is something which you need to important. Again, in tonsillitis you need to remember the Paradise criteria on when you will operate. Okay, except that infection is what, again you need to drain it and you have to start with an antibiotic, but this is having something important thing when will you operate, that is when do you do a tonsillectomy. So one different direction with all these things is something which is there. Again, what is the major important thing is about the clinical features. Again, signs of inflammation is something which you will write. Then again, head and neck infection, I would request you to go and watch the specific things because it's something which is important, right? Quinsy and all those things. So don't form a general template for that. Okay, here major thing is about the management protocol which they will ask, that is follow-up and prevention. So again, they will ask you about DDs and stuffs like that. I don't think it's something which you need to break your head for. Okay, stones, again, how do you manage salivary characterize, something which they ask. Okay, then salivary neoplasm also in surgery, it's the same thing, so you can manage that. Then these three things you have to study separately. Okay, what you will, it's an elongated styloid process. What you will do, you will cut it off. Okay. Then coming to larynx, again divide it. This important thing I don't know, I have included at a miscellaneous, but it's a short 10 or 5 marker, but you cannot have a separate narration, you cannot have a common narration for this. So again, epistaxis stridor, please, and CSM, please study it separately. Okay. Okay, then coming to congenital condition in this laryngomalacia, what is the important thing? Again, you must know about the sigma sign. This sigma, right? Yeah, sigma sign, and also it's a conservative treatment. Again, all these things you have to mention. Again, it's a pediatric overlap topic, and under infection, these are the things which you get. Again, under malignancy, these are the things which you get. Again, this one separate concept you should understand. Again, nerve patches, obviously, you will be knowing. Correct. Again, clinical feature of larynx. What is the function of larynx? Again, voice and airway. So basically, if it's getting affected, obviously you will have a hoarse voice or you will have no voice. Again, if there is a severe damage, you will have airway problems. Okay. Again, on examination, what is the important thing which you need to write about? Indirect laryngoscopy, what you will see. Again, if it's a mass, you will see a mass. Again, if it's an infection, you will see signs and symptoms of inflammation. Got it? That's it. Now coming to the important thing. Oh, it's like this. Okay. So what is the important thing which I saw in a video? What people expect is, for things which you know as a general antibiotic dose, no, it's better if you write not only antibiotic, few things. For example, even non-medicals will know about the dose of cetirizine, paracetamol, amoxiclav, all those things, because whatever this word rewards what, it rewards audacity. So even if you know, no, it's very good if to show whatever you know. Obviously, you know, amox is what, 625 mg, no, obviously you can write that blindly. And again, acetalol, which everyone would have taken, everyone knows it's a 3 days or 5 days thing for your upper respiratory tract infection for 500 mg. Okay, obviously you can remember this. Again, there is, again, I am not saying if you are feeling it tough, definitely you can leave it and go and write antibiotics or something which you can. But if you want to ace the exam or ace the subject, this is what an extra thing which you can develop is what I am saying. And this is should not be there in your memory. If you ask me, it should come as it on its own, because this is something which you will be taking it, right? So I don't think it will be a tougher top. Again, this might feel difficult for you. Again, it's left to you. If you want to study 3-4 numbers, I don't think it should be a problem, because in ENT there is nothing extra to memorize, right? Because if you know anatomy, there is nothing much. But you can remember about these things because that will be a true differentiator from rest of your batchmates or people. Again, everybody knows this, right? Once a day you will take Levocet, Montelukast 10 mg. Again, xylometazoline, obviously, you know, it's 0.1%. Again, if you don't know, it's okay, it's fine. There's no problem. If you don't know also, it's fine. You will learn. But if you know, it's good if you present it up. And again, paracetamol 650 mg. Again, ibuprofen 400 mg. Again, steroids, intranasal fluticasone of 100 to 200 micrograms. So if you know this, it's good. Even if you don't know this, it's fine. You will get good marks. But if you need to get distinction and plus, this, even if you mention, I think it will be in a good state. Okay. Again, these are not the main. I mean, only. I'm not saying these are the only drugs which are used, but these are the drugs which I know the doses of. So I just mention. So I'm just going to mention it. Okay. So again, if you know much more things, then it's very good to write the doses. But for again, there is no emergency thing, like for example in medicine you write about dose of OP poisoning, again you write a dose of ASV, all those things, because those are medical emergency and they expect you to know only that. But again, if you know doses of these things, again it's a true edge is what I will say. But again, don't write wrong dose. If you don't write doses, it's fine, but don't write wrong dose is what I will say. Okay, this was the true differentiator which I wanted to say. Again, I'm saying ENT is one of the easiest subject, okay, where you can score good amount of marks, provided you know how to present it. Okay, the major things which people don't do is diagram. If you do a proper diagram and if you discuss things accordingly, if you classify things accordingly, I don't think anybody could stop you from getting good marks. Again, definition of good marks varies from people to people. I'm not discussing on that. But again, since you have a lot of time, I would advise you to classify things and you know have a general template for things which you feel you cannot remember, but things which are short, for example CSM, tracheostomy, epistaxis, you should have definitive answer. Even in the middle of the night you should be writing the answer. Okay, so I'm not giving a general template for that, though using this you can form a general template. I don't want to use I mean I don't want you to be that easy. Okay, but these things, if you have general template, you are in a good position to get good marks. Again, while writing investigation, don't write just HRCT and leave it off. You have to write what are the things which you will see. Okay, and also even in an PNS of C suite, so that it becomes complete. Okay, again, while writing polyps also something which I have not discussed. I mean, I am not discussing in the general template, because something that is, it's like a short question, right? So I'm not discussing again. Then again, if you have to write about if there's associated any other condition, you will treat that also. Okay, so again, this is like a general overview. With this general overview, now go and watch that video of ENT which we have done, where we have discussed based on the practical approach. That means based on the weightage. This is not based on weightage. This is based on the anatomy and physiology. That means what is there in the body. But Now a good person or a practically thinking person go and watch that video, because we develop an understanding on what is important, what is not important. Okay, so that's it for today. Again, I wish you the best. Thank you.